Hey there, I'm going to do a review about XCP setup in case you're struggling with it. You can purchase an XCP actually fairly inexpensively on Amazon. So I can drop that in the link if you need practice and you're new to dental assisting, you're in a dental assistant program. Let's be honest, especially that yellow one, it can be a little tricky. So the blue and the red for anterior and for bite wing, if it's set up correctly, when you set it up, then you do not need to change it. Of course, your yellow is the one that needs to be set up separately for the right and the left. So I have a little trick, so let's review that today. But let's start with the anterior first. Of course, our anterior being blue, I always want to start with the bar. I say bar to belly, okay? We have bar to belly. In the legs of the chair is what I call this. The legs of the chair are pointing down, right? Obviously, when we sit, we have our legs down, not crisscross applesauce. So then, of course, we have our sensor holder. Our sensor, where our sensor is going to be a place, is away from us because, of course, it's going to be behind the patient's teeth. Then it's going to go on such and look sort of like a chair, right? We're going to have a seat, we're going to have a back, and then this is where our legs are. Yet again, also bar to belly. So bar to belly here. Then we have our window of our ring, and we want to make sure that the ring, and we can see the sensor through the window. So as I put this up to the screen here, to the camera, that you can see through the window, that I can see the sensor. So I know that when my patients bite on tooth number 8 and 9, and my sensor is behind 8 and 9, when I bring over my nose cone, whether it's my handheld or my wall unit, that being that my XCP is set up correctly and I can see through the window, the sensor, that I know I'm confident that I'm going to capture number 8 and 9 on the x-ray. All right, so let's go to bite wing. Of course, it's red. Let's start as well, still bar to belly. Of course, the sensor connection is away from us. So this one does not matter if it's connected on the right or the left. So of course, once we have that connected as such, it looks sort of like a football goalpost. And then yet again, we're going to take our ring and we want to make sure that the ring is set up accurately. Of course, we can see right away in this manner that is not going to be accurate. And as this, I can put on my ring. As we know, sometimes they're tight or sometimes they're too loose based on how many times they get sterilized. That I can see through my window, that I can see the sensor accurately, that when my patient bites down onto this block area to capture those bite wings, 2 on the right, 2 on the left, as an adult, that my sensor, that I'm going to capture exactly what I need, yet again, checking that through the window. All right, so let's talk about our yellow, our posterior, and we're going to start on the upper right. So still I'm gone bar to belly. In this, yet again, another football goalpost, I want to take an x-ray on the upper right. So this section, this bar here is headed towards my right side, okay? I'm on the patient's right. And sometimes you just need to position yourself on the side of the patient as well, that you're taking the x-ray. Your patient has no idea that you might be helping your brain just figure out exactly how to set this up. And then when you're on the left side, you're going to switch it. They have no idea that maybe you're in a little sweat of a nervous when you're learning. So position yourself on the right side of the patient, bar to belly, and the football goalpost here is towards my right side, okay? Because I went on the right side of the patient. Let's just say number 3. So of course, I'm going to grab my seat here. Of course, my sensor is still away from me. Bar to belly, the football goalpost here is to the right. And now, yet again, I need to get my ring. Your ring for your yellow is a little bit trickier. There's a couple of ways that it looks really close, but it's not completely accurate. So I'm going to try to do it wrong here, as we can see. So if I turn this around, my window looks pretty darn close, like it's going to capture some of the sensor, but this way it is wrong. So I need to flip around my ring. And now with my ring in my sensor, I can see more accurately that it's set up correctly. So I'm going to be able to capture that x-ray now on that upper right pretty easily. I have my crest guy here. This was my number 3. So when I have that patient bite together, I apologize, I didn't do this for the anterior and posterior, but I can see that ring is coming, or the football goalpost area is coming out of the patient's mouth, right? If it's flipped backwards, it's going to look like it's going to go down the patient's throat. Not that we're actually going to swallow it, but it's definitely going to be very uncomfortable to the patient. So if we take our upper right and then we take our lower left, now we need to switch it to the upper right. So let's just take everything apart. Start all over, go back to your bar, put everything else on your counter. Now I'm bar to belly, and this football goalpost here is coming towards my left. Left hand, the left side of the patient. I'm going to go back to my sensor seat, my sensor holder. Yet again, my sensor is away from me. And of course, again, line up my ring. I want to make sure that I can see through the window the sensor, bar to belly. The football goalpost is coming towards my left, so I'm set up for the patient's upper left. So when I take an x-ray for, let's just say, on my crest individual, we're calling this guy Cruz in class now, actually. I can see through my window that my patient is biting on tooth number 14, and I'm confident that my window and my sensor is lined up correctly, so I'm going to be able to capture correctly what I need. So just a short refresher there of 6-ish, 7 minutes, but I hope that helps. And we call this guy Cruz because Tom Cruise has a midline that's off. So fun fact, if you didn't know that, that handsome stud Tom Cruise midline of 8'9" is off, I don't know, to his right or left. Go pull up a picture. You tell me, is it to his right or if it's to his left? All right, good luck. Have a good day.